Welcome back to the Nutrition Made Simple podcast powered by Healthy Steps Nutrition. At Healthy Steps Nutrition, our mission is to help people take control of their health one step at a time so they can prevent and reverse chronic disease. We know that we need to look at a holistic framework, and at Healthy Steps Nutrition, not only do we address nutrition, but we also look at sleep, stress management, mindset, support system, and lifestyle, using a habit-based approach, one step at a time to help our clients take control of their health. Today's podcast is focused on really understanding the medical side. We have one of my favorite people, Dr. Shveta Raju, on talking about her experience with medical school and what she's doing differently in her practice. She is a board certified in internal medicine and obesity medicine. She practices primary care and she's the chief medical officer at Gwinnett Clinic. And she's also the co-founder of GC Healthy Living. GC Healthy Living is an amazing wellness practice that they're really using lifestyle interventions, using the Healthy Steps Nutrition framework to empower the patients and clients over at that. So they're working with the Gwinnett Clinic patients really on the lifestyle interventions. She has RDs and physical therapists and lots of people that are helping people take control of their health. I absolutely love what they are doing over there. She's also a CrossFit level 3 trainer. Really incredible that she's combining the nutrition and the fitness and the medical stuff to help people in her community. Today's podcast guest, we talk all about her journey in medical school and why she's made this intentional shift to prioritize the lifestyle interventions and not just stay in the traditional system. We talk about some of the things that she sees working with her clients and so much more. One of my passions is really helping gym owners and us in our local community here in Deerfield Beach to work with local healthcare professionals so that we can really help our clients make meaningful change together. And I'm excited to see what she continues to do in her clinic, and we talk a little bit about that today. So we will get to that episode right after this message. Healthy Steps Nutrition is hosting an incredible event on February 22nd. It's called the Building Bridges Summit. If you are a healthcare professional, a doctor, nurse practitioner, nurse, chiropractor, any type of healthcare professional, and you want to connect with other healthcare professionals that are really looking to prioritize health, you do not want to miss this event in Deerfield Beach on February 22nd. It's completely free. Our goal with this event is to bring together healthcare professionals who are all wanting to prioritize health. We're going to have Dr. Nicole Aucoin come in and speak on fitness and wellness and using the CrossFit methodology to really promote health. He is a past emergency physician and now the founder of the CrossFit Medical Society. I'll be leading a panel with actually Dr. Shveta Raju and a few other physicians, as well as Dr. Enrique Hernandez. He is a local pediatric gastroenterologist here in Boca Raton, and I'm so excited for them to be sharing their story and how they really are guiding clients to practice the lifestyle interventions and not just focusing on the medical interventions. So hope you enjoy this podcast. And if you want more information about the Building Bridges Summit for gym owners and healthcare professionals, make sure that you click the link in the show notes. Enjoy this episode. Dr. Shveta, I'm so excited to have you on the podcast today. Thank you for taking the time out of your busy schedule to jump on and talk about all things health, nutrition, primary care, all the things today. Really excited to have you on.
Yeah, I'm super excited as well. Thank you for having me.
Awesome. Well, let's start off with people who haven't had an opportunity to meet or connect with you yet. Tell me a little bit about your medical background first, and then we'll transition into CrossFit
Sure,
and like the other side of
sure.
things.
So I grew up in a family where both my parents were physicians. My mom is a family physician and my father is an orthopedic surgeon. And I was always drawn to medicine, even as early as, school age, middle school. I was always thinking about doing what my mom does. So I ended up following that path. um, I think in some ways I was lucky because since I knew that early on, I did get to explore a lot of different things in college. I was an anthropology major. I spent a year in the business school, but then ultimately did go into a residency in primary care internal medicine. So I completed my undergraduate medical school and business degree at Emory, and then was up in Boston for my residency at Mass General. Spent 1 year at Duke doing a health services research fellowship before we moved back to the Atlanta area to start our professional practice.
Okay, that's amazing. How long have you been having your professional practice in Atlanta?
So we started in 2012.
Okay.
I joined actually a multi-specialty group, which was originally started by my parents. So now
Wow.
we have 30 physicians, nurse practitioners, PAs, and several different specialties in the group, and we have 17 physical office locations.
You guys are taking Atlanta area by storm, and it's really cool to see what you guys are doing. I had no idea that you ended up coming into the family business. How special for you and your parents. Okay, so you became a physician, you started working in the medical side, and you are you are a very um big proponent of the lifestyle change and lifestyle interventions. Was it always that way? Or, how was the medical side of things when you first started as a primary care physician?
Yeah, no, it definitely wasn't always that way.
Okay.
And both my parents grew up in India, and they were both I would say poor by our standards today, but they were considered lower middle class in the communities that they lived in. So they weren't necessarily worried about where their next meal was coming from, but they lived in very small spaces, lots of siblings, and went through public schools. And that's how they were able to open the door into medicine, which then opened the door for them to immigrate to America. So I would say fitness and nutrition was really not part of their lives or their families' lives when they were growing up because it was, again, not like subsistence or survival, but pretty close to it, And so the relationship with the food was definitely like, what you need to do to survive. They definitely did have, special occasions and eat special foods on those occasions, but there was not really a concept of how what they were eating and their nutrition was ultimately going to impact their health in the long run. So I would say growing up, I just thought that it was part of aging. You got into your 40s and you were going to have one of the three, either high blood pressure, high cholesterol, diabetes, and, sort of from there, depending on if you had other risk factors or did make some changes to your diet, then you would develop a couple more. And, and I always saw the role of a primary care physician to sort of help patients navigate that, identify when they had the diagnosis, treat it appropriately with the medications or other treatments that may be needed, and then thereby prolong their lives and avoid the complications of those metabolic diseases. So it's definitely a big shift in my thinking over the past few years as I've learned and experienced training CrossFit and learned a lot about the nutrition side, and then started to implement that into my practice.
I I think, so many times we think we go to a primary care physician and they know about nutrition. You've done a lot of research yourself on fitness, functional fitness, the importance of strength training, the importance of nutrition over the past few years, you just said. But what was education like in those areas in medical school and even in undergrad?
Yeah, I would say it's absent. There's really no education on how humans should be nourishing their bodies. Maybe the one exception was, as I was going through training, there was an increasing emphasis throughout my training years on breastfeeding for infants. But beyond that, I really don't recall learning very much about how to use nutrition to prevent disease, what are the specific recommendations to make for a particular patient when they have a diagnosis. So just to sort of explain, like, we learn about a disease like diabetes or type 2 diabetes. And, one of the things we study is like, what are the commonly used medications? And what is the dose? And when do you start them? And in what order? And who developed those guidelines? Well, there's no such thing related to food or macronutrients or, food composition, nothing. I think there's some components that are generally agreed upon in the medical community, like let's try to limit soda. Let's try to avoid junk food or limit junk food. But I don't think there's enough training or education about, why these things are important or how to actually talk to your patients about them. I also think it's sometimes really difficult because most patients approach how they eat based on how they grew up. And so if you don't understand their traditional diets or their family traditions, then you are sometimes lost as to how to even start to recommend any kind of changes.
And in reality, the average doctor, what is it, 15 minutes that you're spending with a patient per year? How many people are the general doctor's office. So, how much time are you spending looking at blood values, analyzing the medications? Are they working? Are they not working? Talking to them about a new medication? How much time is left over for let's talk about the lifestyle changes that you need to make to start preventing and reversing some of these issues?
Yeah. Yeah. I think you really do have to have it at the forefront of your mind to prioritize it and make time for it. I do think at least where we are in Atlanta, we have a good number of physicians, and that's definitely not true all across the country. I think in urban areas, and again, depending on the specific city, but at least where we are, we don't have like long wait lists for patients to get seen or choose a new physician. So we're lucky that way in primary care because we do get to see our patients fairly frequently if needed. I think some of the positive changes with our health insurance have emphasized primary care more so. We do have the opportunity now to be reimbursed for some of the time that we spend in additional counseling. Those counseling codes didn't even exist 10 years ago. So there's definitely some positive changes happening. And I see in the younger physicians that they're also more interested in learning about this and doing education beyond what they just learned in medical school so that they do feel comfortable. But I also just had a fourth year medical student rotating with me from the Medical College of Georgia, and he said nothing has changed in terms of the traditional curriculum. They don't learn anything, at least in those first 4 years.
Yeah, and I think that that's something that the general public doesn't even realize. Maybe your physician isn't talking to you about nutrition because they haven't educated themselves on it and they weren't taught that in school, and they're teaching you or talking to you about what they know, which is something to keep in mind. So, you should have a multiple disciplinary team of people, someone that's talking about nutrition and fitness and your primary care physician and people that are communicating with each other. And that's something that you guys have intentionally done at GC Clinic and really GC Wellness, the new initiative that you've launched. So talk to me a little bit about, you've been in primary care for a number of years at this point. What are some of the changes that you have made? And maybe even let's start with some of the frustrations that you saw that caused you to say, all right, we need to start really prioritizing and making GC Wellness and have a more preventative focused practice.
Yeah, so I know that the terminology is a little bit confusing, but the name of our practice is Gwinnett Clinic, and then the uh, new component that we've launched in the past year is called GC Healthy Living. So within GC Healthy Living, our primary goal is to provide accountability and coaching for improving our patients' fitness and coaching for improving our patients' nutrition. And even though, as I mentioned, some counseling services are covered, and you're the queen of this, Nicole, coaching, as we know from our training in CrossFit, is totally different from just counseling. And so, I think, again, even within medicine, the past 10 to 15 years, there's come to be an understanding that we need a component of coaching. There's actually a new role that's been brought into some practices called health coaching. And I would say the staff who are helping me in this GC Healthy Living program are essentially health coaches. And, so that's been the really exciting part because I think within the CrossFit training system, and now that we've gone through your system, I can see that really nobody does coaching better than the CrossFit space. At least I haven't seen it. I don't know if you have. And so it's really fun and exciting to bring that into the clinical space where people are coming to us often looking for these types of supports, and we're actually able to provide something to them that we know is going to be effective. But I have to say, it wasn't so much frustration that prompted me to bring these two parts of my life together. It was really almost more like discovery because, as I mentioned, I just discovered for myself, like, wow, this works. This is working. I'm getting older, but I'm getting fitter. I feel better. I'm, performing better in all the different aspects of my personal and professional life. And so really, I wanted to bring that excitement of discovery to my patients. And I think what's been exciting in this past year is finding a team of individuals who really share, they kind of went through the same experience themselves, and so are equally excited to bring that to patients.
I think sometimes, and I worked in the hospital setting, so you guys have different things that you probably can do than the rules that I had to follow at the hospital. And I found it really frustrating to be able to not talk about the nutrition recommendations and just giving the general recommendations that was required to say, and not venturing from that. So I think it's really cool that you guys are kind of paving a new way. Not many primary care practices are really um, having an option for people, and it technically is a separate entity, but having an option for your patients to go and get the lifestyle intervention help that they need. And I've been following you for a while, and it's really exciting that we've partnered together to be able to help you guys be able to deliver the nutrition coaching aspect in addition to the metabolic conditioning and the fitness side of things that you guys have already been doing. And you've been involved with CrossFit Health, and even with the CrossFit Medical Society, we're the first one to do the grand rounds, talking like you're leading the way in regards to physicians in CrossFit that are saying like, hey, there is a better way to do this. We can really prevent and reverse chronic disease through the nutrition aspects and fitness. And we don't need to just go to medications first. And yes, there's a place for that, but we need to also be really prioritizing and putting the lifestyle interventions at the forefront.
Yeah, and I think I feel really fortunate because so my husband and I have worked together on this project, and he started training CrossFit about 4 or 5 years before I did, and he was always super interested to do the training side. So he went and did the L1 totally on his own. He didn't know anything about CrossFit Health. He just showed up at a seminar in Atlanta, and Chuck Carswell was there, and he took it, and he got his L1, and then again, totally on his own, did all the other seminars. He went to the gymnastics seminar and the weightlifting seminar and the metabolic conditioning seminar and the running one, and then eventually did the L2 and then the L3. And I think that exactly what you said, which is that we've studied it, we understand the methodology, we understand the science behind it, but his practice doesn't allow him to really merge it the way that I have because he's a neurologist. So the patients that he's interacting with, yes, absolutely, they do benefit from many of the services that we're offering, but they're not primarily coming to him with that preventative question. Whereas in primary care, we do a ton of annual wellness visits. And so it really just opens up that whole conversation from the get-go. And I also, one thing that I've really taken away from your program, that really I think has helped me with these conversations with patients is the accountability piece. Because even once you have all this knowledge, and we all know this, whether it's in our gym or in our nutrition coaching, not every patient or client is 100% successful. Everybody's still on that journey somewhere. And that accountability piece, and again, just getting back to the coaching is so critical. So, yeah, I mean, I think that's why, I always tell my staff in the GC Healthy Living program that I want all of our patients in primary care to be participating in a component of the healthy living program all throughout their lives. Because even when you're sort of thinking again about that sickness, wellness, fitness continuum, even if you're at wellness or even if you're at fitness, I mean, you're just one injury away or one illness away from kind of sliding back the other way. So the more tools you have in place, the less likely that is to happen.
Absolutely. No, I think bringing this up is really important. So your goal is to have everyone that's going to the clinic to also be involved in some way, shape, or form with the lifestyle intervention piece, prioritizing that. Uh, when most people go, take your clinic out because you guys are leading the way for most primary care physicians practices. When you're going to there, the way I see it is like, okay, this is my checkup, right? I'm gonna get my blood values, I'm gonna see, and then what ends up happening is like, okay, your numbers are staying the same or they're
Mhm.
trending up. You need to do something. And like, that's the extent of the conversation.
Yeah.
uh, or, hey, we've reached the line where now you're promoted to a medication. And what if it was different? Like
Yes. Absolutely.
what for the general public? They're going to get their annual visits. Like, what questions should they be asking their doctors?
So I think the first thing to realize is that when those blood markers start to move, it's things have already gone really far. So that's actually kind of a late marker, but that's what we're screening for in a medical setting. So I think that's one thing to really keep in mind. The second thing I think for patients is to really understand and educate themselves on what is a healthy lifestyle. Because I think there's a lot of misinformation, not just in social media, but on the internet and just in the general community about what is healthy.
Yeah.
And this is one of my favorite parts about CrossFit is that when you go to a CrossFit that's been doing CrossFit successfully, you find people who are actually living a healthy lifestyle, or you should. And that includes not just fitness, but many other components, such as, how they're nourishing their body, how they're managing their schedule, how they find that 1 hour a day to make their health a priority and exercise. So I think that is really the main thing I would say for patients. And I've heard sometimes patients say, "Well, I'm not really likely to ask my doctor about lifestyle because I'm not sure if my doctor is living a healthy lifestyle." And I
Mm,
think that's a really valid point. I don't have a great answer for that question because as we've talked about, there's not a lot of education for doctors on what is a healthy lifestyle in medical school. There's not really great consensus or guidelines around that. And then, when you're meeting a doctor, especially if it's early on in the relationship with that physician, you really don't know if that would be the right person to ask. So, I think that's where I do appreciate the work of the CrossFit Medical Directory because that is
mhm.
one resource where you could potentially find a physician who does have some background in this particular healthy lifestyle, the CrossFit lifestyle. Does it mean that they're following it perfectly? No. But they still, maybe much closer to it than someone who's not familiar with the methodology at all. All that said, there's actually some really good resources in our public health literature. So I do a seminar every year, the past couple of years at the Emory Business School, and it's for seniors in the BBA program, and it's on leadership. And we focus on different topics: leadership development, time management, fitness, and nutrition. And when I start my seminar on fitness, I start with the CDC guidelines on what is recommended for adults for fitness in this country. And it's very simple. It's 150 minutes a week of moderate intensity cardiovascular exercise plus twice a week strength training, where you try to train all major muscle groups. And I talk to patients about this a lot as well. So, yeah, I mean, you could try to figure that on your own, or you could join a CrossFit gym and go to class 4 to 5 days a week, and you will meet those guidelines. So I think, that's a good starting point. And then similarly, I think that the national guidelines around food have improved. Are they perfect? No, but they definitely, like the My Plate is much better than the pyramid that
Pyramid.
we use. Yes. So, starting with those and then asking questions and then seeking out other professionals who are kind of asking the same questions is probably the best route for patients. But I totally get it. It's sort of like, again, like I really recommend the CrossFit methodology. I know it works well. I understand the science behind it. But sometimes if somebody's in a particular city, I don't know exactly which gym is doing it correctly. And I think it's the same way with physicians. So I wish we had more standardization, but I don't think we're quite there yet.
Yeah, I think you bring up a really good point. If you're looking for a physician or a doctor that understands the CrossFit methodology, is aligned with that, that is prioritizing lifestyle interventions in the best way that they can, depending on what discipline they're in, the CrossFit Medical Society is a really good option for people to just find someone. Um, HireANutritionCoach.com is a great place to find a
Mhm.
healthy steps nutrition coach near you, so that you can see, because just like physicians, just like CrossFit affiliates, just like nutrition coaches, you don't know what you don't know. And everyone's kind of doing something a little bit different. Even, when I went to school to be a dietitian, the things that we teach in HSN are not necessarily what I learned in school, the way we coach people. And it's a lot of practice and trial and error and figuring out what works and what doesn't. So I think it's really cool what you guys are doing to really empower health is the best way to put it in the Atlanta area. What, if someone wants to find you, seek out one of the tons of clinics that you guys have in the Atlanta area, how can they find you?
Yeah, so on the primary care side, they can just go to our main clinic website, gwinnettclinic.com. They can also just go to Google and search up my name. We do pull up, I think our directory listings on our clinic website pull up if you search up her name. So
Perfect. And then we'll link in the show notes, links to the clinic, and then you also have the GC Healthy Living side of things too, where you guys are really doing accountability coaching and all of that. Any final thoughts for people as they're, thinking about, okay, I understand where my primary care, my annual visit, I'm getting some blood work done, but that's a marker that's probably telling me what my habits are doing.
yeah.
Maybe actually I want to touch on this really quick. A lot of people have questions on Ozempic. A
Mhm.
lot of there's a lot of information out there. Um, for people that are on Ozempic, I think it's so important that you really understand the strength training and the nutrition side, because when and if you get off of it, you're just going to gain the weight back if you don't change the lifestyle factors that you have. Talk to me about your thoughts on Ozempic.
Yeah, I mean, so I did actually recently a fellowship in obesity medicine. So
Okay.
I am board certified in obesity medicine as well. And it's interesting because I started that fellowship in 2022 before these injection medications were approved for weight loss. So um, the obesity medicine fellowship prior to the current era was really a lot of it was about the physiology of obesity, the hormone pathways, how the body regulates weight set point, and there is actually quite a bit of nutrition and fitness education in that particular fellowship. So it wasn't really something that was in my primary care training or my regular medical school training, but I did get quite a bit there. And so the primary population that a lot of obesity medicine physicians were seeing prior to this time was post bariatric surgery.
Hmm.
And it's actually the exact same with bariatric surgery. If you don't change your nutrition and the way you're moving your body, you're very prone to weight regain. And that's actually the population that many of these drugs were initially tested and studied in to see if they could be beneficial for weight loss. But just as you mentioned, whether it's Ozempic or some of our older medications like phentermine, Topamax, there's some branded ones, Qsimic and Trave. Primarily, they work by reducing appetite and reducing the amount of food that you're taking in. But you and I both know that really to change your body composition, you need to be fueling your body. You need to provide your body with the appropriate macronutrients and particularly protein and fiber to build those muscles. And then you have to do the actual thing, you have to move the weight and run really fast. Just eating those foods doesn't alone fix the problem. So it's the same with the medications. I mean, for a patient who overeating is a really big problem, it can be very beneficial. And there's all kinds of reasons, including mental health reasons, why people overeat. Similarly, if somebody has diabetes already, they're already a type 2 diabetic, I think these medications are a good option because our older medications like glipizide and insulin cause people to, even though it control their glucose levels, they would gain weight. And so that's one benefit of using these types of GLP-1 agonists for that population. So just like everything in medicine, I think, you really have to find the right patient and the right dose and the right treatment plan. It can be one piece of the puzzle. The way they're being marketed by the pharmaceutical companies right now is really not ideal. And I think the general public thinks, oh, if I can just get my hands on this injection, all my problems will be solved. But I think within a few years, everyone's going to sort of start to realize that it's not just, like you said, the only solution. And definitely without making those changes, you have to stay on the medication.
Which is unfortunate because if you're going to significantly reduce your appetite and calorie intake, then you're going to lose weight really fast. That's not going to just be fat, it's going to be muscle too. And then your metabolic rate is going to go down. So you actually need less calories. And then when you get off of the medication, you're going to regain the weight plus more faster because your muscle mass has gone down. And we know that muscle helps you be able to burn more calories throughout the day. So strength training is vital. I've been following Dr. Mark Hyman for a long time, and he talks about, he's had a couple episodes on like microdosing the medications and people not having as many side effects when they are having a microdose. We work with some clients. There's a local physician that refers patients to us that are on the medication, which I want them to get the lifestyle intervention and the help that they need. So if you are taking the medication or considering it, I strongly encourage you to get a coach to help you with the nutrition, join a CrossFit gym to prioritize the strength training piece, because ultimately you really need that to set yourself up for long-term success and take control of your health.
Yeah, absolutely. And I think, um, what we're seeing with CrossFit and the methodology and longevity, it's clear that everybody sort of needs that support at different stages of their life, and, whether it's the weight or it's a blood marker or it's the blood pressure, it's really just up to each person to see if they want to wait until that happens or get ahead of it and sort of learn all these life skills so that either they can at least delay the onset of those types of things or maybe even, totally prevent them. But at the very least, they're going to reduce their risk. Um,
Absolutely.
yeah, I love it. I've heard this said before, but it's like there's only one, intervention that has positive side effects, and that's exercise. And you could probably say the same for really good and nourishing whole foods.
Absolutely. Any final thoughts as we wrap up today?
No, I feel like we have so many other things to talk about. So, but this is good. It's a good start.
It definitely was a good start. Thank you so much for your time. I'm excited to watch and see what you guys do. I'm excited that, HSN is able to play a small part in helping you guys deliver a habit-based coaching program at the wellness facility. And I'm really excited to see what you guys end up doing. I know that you're pretty involved with the CrossFit Medical Society and other initiatives coming out. So thank you for trusting us to help you. And I'm excited for us to continue to work together. And we'll definitely come back on and have you on for more podcast episodes to talk about other things related to nutrition, health, and medicine.
That sounds great, Nicole. Yeah, I mean, we've had such a positive experience, just especially on the coach development side. I think it's given our coaches a lot more confidence to, talk about these topics and really engage with the patients when they have questions and, meetings. So really starting to meet them where they are and then guide them.
Well, I'm excited to hear about all the transformations that happen now that you guys are adding in all the pieces of the puzzle. I hope you enjoyed that episode with Dr. Raju. She's such a wealth of knowledge and truly practicing what she preaches and really helping her clients understand what they need to do to take control of their health, and not just telling them and giving them a piece of paper, but actually providing a coaching program for people to really take control of their health. we're so excited to be partnering with them and for them to be able to use the Healthy Steps Nutrition Framework to impact the people outside of Atlanta in the community that they're working with. If you want to learn more about this, if you want to connect with other healthcare professionals that are really prioritizing health and the lifestyle interventions, please join us at the Building Bridges Summit at Healthy Steps Nutrition HQ in Deerfield Beach. It is going to be an event for gym owners, coaches, and healthcare professionals to really understand how do we work together. Let's make connections, let's network, and we're going to be hosting a panel discussion. Dr. Raju is going to be on there talking about her experience really creating this lifestyle intervention program. Dr. Enrique Hernandez is a gastroenterologist here in Boca. We have been working together for over a decade. He refers his patients to us, and we work with all of the kids and families to help them understand how to eat well and prioritize their health. Many of these kids have fatty livers or high triglycerides, and we're able to help them at such an early age take control and understand what does healthy eating look like. Super excited about this summit, and I hope that you join us. Click the link in the show notes so that you can get more information.